performing hand hygiene and giving patient privacy. Of note, the medical assistant got the patient's vital signs before I walked in. Hi, how are you doing, sir? My name is Braxton. I'm going to be your nurse today, and I'm just going to do a quick head-to-toe assessment for you just to get a baseline for the doctor. If you could tell me your name and date of birth.
Jimmy Johnny, January 15, 1965.
Any allergies?
No.
Okay, just going to make sure that matches up with the armband here, and it does. How's your mood been these past few days?
Fantastic.
Good. Patient's mood does seem pleasant. Good hygiene and is answering my questions appropriately. Have you been having any pain?
No, sir.
Okay, good deal. So, looking at the patient's skin on his face, no skin discoloration is found. Looks appropriate for race and ethnicity. Going to move over to the patient's scalp. Inspecting and palpating for any lesions, any masses. No masses or no lesions or masses are palpated or inspected, no infestation. While I'm here, I'm going to, in circular motion, palpate for the patient's lymph nodes, starting with occipital here, post-auricular, pre-auricular, retropharyngeal, submandibular, submental. Going to palpate for posterior and anterior cervical chain and supraclavicular lymph nodes. No lymph nodes are palpated. While here, I'm going to check the patient's thyroid gland. Does not seem enlarged. No nodules are notated. I'm going to check patient's trachea. Trachea is midline. Okay. Going to check patient's ears, pulling earlobe back and up. No swelling discharge found on this side. Scan cerumen. Same on this side. No swelling discharge. Scan cerumen. Sir, if you could tilt your head back for me. Checking nostrils. No discharge found on either side. No erythema. No deviated septum. Open your mouth for me. Okay. Moist pink oral mucosa. Teeth are intact. And right alignment. Say ah for me.
Ah.
Uvularized. Perfect. And now I'm going to test for the patient's cranial nerves. I understand the medical assistant did the Snellen test for you before I walked in. Visual acuity was 20 out of 20. That was assessing for cranial nerve 2. Now I'm going to assess your olfactory nerve. If you could close your eyes and obstruct one of your nostrils. You want to wave the scent here? If you could just tell me what that is.
Lavender.
Okay, other nostril obstruct that.
Peppermint.
Okay, olfactory nerve is intact. If you could close one of your ears for me. And I'm just going to whisper 3 words. If you could just repeat those back to me. Guard, dog, cat.
Guard, dog, cat.
Okay. Over here. Boat, plane, train.
Boat, plane, train.
Great. If you could stand up for me. Close your eyes. Okay. No swaying is notated. If you could have a seat again. Okay. That was testing for the vestibulo-ocular nerve, which is intact. Going to assess for trigeminal nerve. Tell me when you feel this.
Feel it?
Feel that?
Yes.
Feel this?
Yes.
Okay. Open your jaw. Close it. Open again. Okay. Trigeminal nerve is intact, and no TMJ was able to open and close without any clicking. Sir, if you could smile for me, frown, puff out your cheeks, raise your eyebrows. Okay, good deal. Facial nerve is intact. Sir, just look forward for me. Okay, pupil constriction, pupil constriction. Look at the tip of my pen light and just follow it. Okay. Pupils are equal, round, reactive to light, and accommodating. If you could follow my pen light without moving your head. Okay. And that was testing for cranial nerves 3, 4, and 6. With the eye movement, patient was able to follow appropriately with no nystagmus noted. Sir, if you could open your mouth for me, say ah.
Ah.
With an invisible popsicle tongue. tongue depressor, I would elicit the patient's gag reflex. And can you swallow for me? Okay, good deal. So hypoglossal, glossopharyngeal, and vagus nerve are all intact. Shrug your shoulders up and down, look side to side. Okay, do that again. Okay, all right, over on this side, perfect. Accessory nerves are intact. Awesome. If I could have you stand up, walk that way a few paces, and walk back to me in a heel to toe manner. Good deal. You can have a seat. Gait is good, balance is good. Going to test for upper and lower motor neurons. If you could, in a rapid fashion, do this with your hands. And now with your shins traced along, or with your heels traced along your shins. Good. Upper and lower motor neurons are intact. I'm going to have a patient lean back in a 45-degree angle. Look away. Okay. Look away. No jugular vein distension is found on either side. I'm going to palpate patient's carotid arteries, just one at a time, +2 and symmetric. With my stethoscope with the bell on, I'm going to auscultate carotid arteries on both sides. No bruits are heard. Okay. Moving down to the patient's upper extremity, looking at the skin. Skin is appropriate for race and ethnicity. Palpating, no masses are felt. No obvious lesions are assessed as well. Sir, if you could raise your arms sideways, straight ahead, circular motion. Range of motion's good. Flex your arms like you're lifting up a weight. Push against me. Pull towards you. Squeeze my fingers. Strength is 5 out of 5. Going to palpate radial pulses here, which are +2 and symmetric. Brachial pulse, +2 and symmetric. Okay, going to check tendon reflexes. Relax your arm and bend it for me. Okay. Awesome. That was bicep tendon. This is tricep. And brachial radialis. All right, and I would make sure the tendon reflexes on patient's other arm is good and appropriate as well. If I could see your fingers, I'm going to check your capillary refills on each hand. And cap refills for all fingers are less than 3 seconds. Going to check patient's skin turgor just below his clavicular. Skin elasticity rebounded instantly. Now I will auscultate the patient's heart sounds and lung sounds. Actually, first, before I do that, I'm going to inspect his thoracic cage. Patient does not seem to be in any respiratory distress, and normal respiratory rhythm. Take a deep breath in. Chest expansion is equal and symmetric. Again, I do not notate any lesions, abrasions, no skin discoloration. Now I'll auscultate the patient's heart and lung sounds with making sure the diaphragm on my stethoscope is on. Starting with heart sound, aortic valve at the right sternal border, second intercostal space is heard. Checking pulmonic valve at the second intercostal space, left sternal border. Moving down, left sternal border, third intercostal space for Erb's point. Going down, fourth intercostal space, left sternal border for tricuspid valve. Here, we're mid-clavicular, left side at fifth intercostal space, listening to the mitral valve. And if I could have you lean forward. For 1 minute, I would listen to the patient's apical heart rate in this position, while also checking his carotid artery for any pulse deficit, which no pulse deficits are found, and heart sounds all sounded normal. I'm going to check patient's lung sounds now for doing posterior and lateral. And each time my stethoscope touches the patient's skin, I would ask him to take a deep breath in and out. Checking lateral, lateral, if I could have you face this way, sir. Going to check posterior breath sounds as well. Making sure to avoid the scapula here. And again, asking patient to take a breath in and out every time he feels my stethoscope touch his skin. Okay. And all breath sounds are clear. Sir, if I could have you lean back with your head here. Perfect. Going to assess abdomen. Sir, when was the last time you had a bowel movement?
This morning.
Okay. Any difficulty urinating or any foul smelling urine, pain with urinating?
No.
Good deal. Assessing the abdomen, no skin discoloration, no lesions are found. Umbilicus is midline, and I will auscultate all 4 quadrants of the patient's abdomen, making sure my diaphragm is on, starting with right lower quadrant, going in a clockwise manner. I will listen to each quadrant normally for 1 full minute. Patient has normal active bowel sounds. Now I'm going to auscultate for the patient's abdominal arteries, starting here midline, checking for aorta. Okay, moving down, checking both sides for renal. Okay, now moving down, checking both sides for iliac arteries. Okay, no bruits are found or heard. I'm going to check for tympany now, again starting right lower quadrant, or percussing. Okay, tympany is heard in all 4 quadrants, and I will palpate the patient's abdomen. Sir, any pain here?
No.
Here?
No.
Here?
No.
Here?
No.
Okay, no pain is reported and no masses are felt. Moving down to the lower extremities, normal hair distribution on both sides, no skin discoloration. Looking at each leg, no edema is inspected. Going to palpate. Here, skin is moist and warm. Palpate, skin is moist and warm. No edema is palpated over the shins, ankles, or feet. Sir, if I could, 1 leg at a time, have you lift up and bend your knee. Good deal. Other leg. Okay. Push up against me. Okay. Lift your toes up. Push on the gas pedal. Good deal. Strength is 5 out of fine. Normal range of motion. Going to check cap refills of each foot here. And cap refills are less than 3 seconds on each digit of the feet here. Checking posterior tibialis pulse, +2 and symmetric. Checking dorsalis pedalis, +2 and symmetric. Okay. So I'm going to have you sit back up, face this way. Lastly, I'm going to check patellar reflexes. Striking hammer here. Oh, one more time. Striking hammer here. Okay. Striking hammer here. Okay. Patellar reflexes are intact. All right, sir, let me let the doctor know of these findings. We'll be right back with you. And as I exit the patient's room, I'm going to perform hand hygiene again.